Princess of Wales, extraordinary. We didn't see this coming, did we? Admitted to hospital for planned... In fact, she's had abdominal surgery.
That's right. We hear that the surgery was successful. It's expected that she'll remain in hospital for 10 to 14 days.
Which is quite a long time. King Charles is going into hospital next week being treated for a benign prostate condition.
So joining us now is our Royal Correspondent Cameron Walker and Royal broadcaster and commentator Rafe Haydel-Mancu. Good morning to you both. Cameron, I thought of you yesterday when these announcements were made in such quick succession. And I was very keen, actually, to know your opinion on how unusual that is and what the logic would be from Kensington Palace, particularly from a kind of communications point of view, that rather than do these two announcements on, say, one press release.
Yeah, it was certainly a double whammy in terms of health scares yesterday. We certainly weren't expecting either of them. But to be honest, over the last couple of weeks, I have been asking myself, why is it we haven't seen the Prince and Princess of Wales or indeed His Majesty the King out and about in public as perhaps we expect we would do. Now, we have to remember that the Prince and Princess of Wales are looked after by a separate communications team at Kensington Palace. Buckingham Palace looks after His Majesty the King, but of course they do talk to one another. My understanding as to why Buckingham Palace decided to release that statement so soon after Kensington Palace, an hour and a half between the two, is because the King had a number of engagements at Dumfries House today and tomorrow in Ayrshire, which had to be cancelled on medical advice. And the thought was that if the King kept quiet and cancelled them, and then it would just leak out. He'd had to cancel them on medical advice, and then all of us would be speculating that the King's in really bad health, which clearly isn't the case, because Buckingham Palace has been very clear that the King does have an enlarged prostate. It's benign, and he'll be having a procedure, as many men do his age, next week. And it is very rare that a member of the royal family would give us that specific medical detail as to the diagnosis. I'm told the reason is that the King wants to encourage other men his age to get checked out by a doctor if they're experiencing similar symptoms. So that's perhaps the reason why we had those two statements in such quick succession. The Princess of Wales remains in hospital, as you said, 10 to 14 days she's going to be there, which sounds to me perhaps like a pretty significant procedure. And then she's expected to spend 2 to 3 months at home convalescing. We're not going to see her until at least Easter, so it's clearly been quite significant. The Prince of Wales is going to split his time between spending time in hospital with the Princess and at home looking after the children. But of course, next week there's going to be a situation where we have the King in hospital and the future Queen.